Campaigners in Dorset fighting to save their local ambulance say the CCG and South West Ambulance Trust have broken a promise not to cut the service until a consultation with stakeholders has ended. Freedom of Information requests seen by the BBC show the number of times a single-person ambulance on Purbeck has been staffed and available to deploy has more than halved in the past 3 years. That's despite assurances the service will be fully maintained until after public discussions had concluded. Resident Thelma Deacon says having a response vehicle close at hand saves lives.
It is absolutely crucial. It's life-saving. The minutes tick by and a person's health deteriorates very, very rapidly, and you cannot reverse that process. People either lose their lives or they become disabled for the rest of their life because of the prompt action. It's totally a necessity.
But first, back to Swanage and the situation where locals have been fighting to keep the Swanage ambulance car while the CCG and the South West Ambulance Trust conduct a review. More than 8,000 people have now signed a petition to save the locally based quick response vehicle. But Freedom of Information requests show that the number of shifts where the vehicle's been available and staffed have more than halved in the last 3 years, and at the same time response times for Category 1 incidents have more than doubled. We'll talk to one of the campaigners in just a mo, but here's Roger Ridout. In his 80s, and not long after a triple heart bypass, he suffered a cardiac arrest on Studland Beach. National Trust wardens dialed 999, and Roger told our reporter Tristan Pascoe that without the local ambulance car responding so quickly, he wouldn't be alive today.
Had the ambulance not been there in 2012, the rapid response crew, I don't think I'd be here now because I had a cardiac arrest. And basically what happened was that I was completely out of it, and they gave me CPR and the defibrillator. And basically they brought me back. I was actually gone for a few minutes. Wasn't in this world any longer.
Roger, in a nutshell, how grateful are you that the service was able to respond?
Absolutely, totally grateful. Without them, I don't think I'd be here today. And it really is necessary, particularly in a place like Swanage in the middle of summer, because it gets so busy and the roads are all clogged up and this, that and the other. And an ambulance would probably take at least 3/4 of an hour to get from somewhere like the Baker's Arms, at the end of the Upton bypass, because the traffic is horrendous. I have a lot of sympathy for the ambulance service because obviously their funding is stretched, etc. But by the same token, I think this is vital that we keep a rapid resource.
Roger Ridout talking to our reporter Tristan Pascoe there. Well, Debbie Monkhouse is on the line with me. Morning, Debbie.
Morning, Steve.
Labour Town Councillor in Swanage and a campaigner to save our ambulance. What did you make when you saw these Freedom of Information figures? More than double waiting time, more than halved staffing numbers?
Well, obviously we were absolutely horrified, Steve. We noticed we hadn't seen the car around town quite as much, but it hadn't occurred to us that the staffing had been run down to kind of 42% it was averaged over the whole year, and in some months 3/4 of the time the car wasn't staffed. And when we talk about 15 minutes on average to get to a Category 1 patient, we're talking here about people who've stopped breathing, heart stopped beating, or who are unconscious and unresponsive. Basically, they're people who will die within minutes. That's why the target response time is a maximum of 7 minutes. So an average time of 15 minutes tells a very awful story.
Yeah, I mean, you're comparing unusual years here, I guess, is a potential argument. You're comparing 2019 with 2021, so normal pre-pandemic year with a year in which people were subject to various lockdowns and stuff. I don't know if that impacted on the staffing of the ambulance car.
Well, I mean, the interesting thing is that the call-outs to Swanage and Purbeck have actually declined. So there were more call-outs to Swanage and Purbeck in 2019 than there were in 2021. So if increased demand has played a part generally, we haven't seen that in this area. And I don't think the Ambulance Trust are saying that they've run all their services down to only operating 40% of the time. I mean, from the Freedom of Information Act response on the staffing, they actually explain that it's gone down to 40% because they've taken the staff off and put them on double crewed ambulances instead. And they also just say very specifically, as of the 4th of June 2020, we no longer have Swanage solo vehicles in our resourcing plan. I know they're now saying that was a mistake, but clearly they felt the need to explain why it was so poorly resourced, which suggests that isn't what's happened across the board. And if that's not the reason, what is the reason?
And just talk to me about the double crewed vehicles versus the solo staffed ambulance car, because you would, I guess, say that for Swanage, that kind of nimble single person operation can do a lot of good.
Absolutely. The car is tethered to Swanage and Purbeck. It doesn't routinely take patients to hospital, so it's much more likely to be here when we need it. Whereas the ambulances are out working across the county. As we know, the ambulance trusts are under a tremendous amount of pressure, and it can take a very long time to get back to this end of the Purbeck Peninsula. So the car can save lives, it can stabilise people, the car paramedic, while we're waiting for an ambulance to come. And we spoke about the Category 1 response time being 15 minutes. For people having a stroke or heart attack, that's Category 2, an hour and 12 minutes was the average response time. Also, what is never mentioned is that half the time, when there's an emergency call out, the car paramedic can treat the person at the scene, which saves wasting a double crewed ambulance that's often had to come from miles away.
South Western Ambulance Trust have given us this statement. They say, we and the wider NHS continue to experience a sustained high level of demand, whilst also being impacted with the inevitable increases of staff absences during the COVID-19 pandemic. The ambulance car based at Swanage is no exception. We know and understand the local community has a vested interest in the future of this resource. We are listening to the views of local people. The Purbeck car is included within the South Western Ambulance Trust resourcing plan, and you mentioned, Debbie, the correction to the FOI request soon to be issued to reflect that. They say, finally, we're sorry that some patients are having to wait longer for an ambulance as a result of health and social care being under severe pressure. People are working incredibly hard day and night to enable us to be there for our patients whilst prioritising those who are most seriously injured and ill. Just finally, Debbie, your response to that?
Well, it's quite obvious that something's been going on in relation to the paramedic car, because that is not the average level of staffing across the fleet. And I do struggle with things like invested interest. We're talking in 2019, when the car was fully staffed, it attended to over 400 risk to life cases in Swanage. The total number of call-outs that attended in Swanage was just under 1,000, but there was risk to life in 418 of those cases. So obviously the community is very concerned about the running down of a resource that potentially saves that many lives.
Debbie, really good to talk to you as always. Debbie Monkhouse, Labour Town Councillor and member of Save Our Ambulance campaign in Swanage. We're going to start, though, back on the Purbecks. For 3.5 years now, people in Swanage have been fighting to save their local ambulance car, while the CCG and South West Ambulance Trust conducted a review. But new Freedom of Information requests show the number of shifts where the vehicle's been available and staffed have dropped by more than half in the last 3 years. And at the same time, response times for Category 1 incidents, this is where a person stopped breathing, have more than doubled from 7 to 15 minutes. We're going to talk to someone whose life was saved by the ambulance car in a Mo. But first, have a listen to these people in the market in Swanage who said they wanted the local ambulance to remain exactly that, local.
I think it's shocking because so many people really depend on having an ambulance that comes quickly, that is based in Swanage, not having to come all the way from Poole or Wareham.
We are very much out on a limb here on the Isle of Purbeck, and though that extra time that would be spent waiting for an ambulance, which we know are being very, very delayed now, and then having to go all the way over to Bournemouth, could have
life-changing consequences for individuals living in Swanage.
My view would be it's been cut because of cost, not because of the need. We're very cut off here in Swanage in a way. If it's the night time and the ferry's not running, it's a long way to go to Poole, and it's a long way to wait for an ambulance.
If something's got to come from miles away, chances are you won't. If you've got something serious, you won't make it. I fully support one, fully here all the time.
Just a few voices from Swanage there. Well, as I say, somebody who had his life effectively saved by the Swanage ambulance car is Kevin Egan. He was 51. The car recognised that he'd had a stroke and took him straight to hospital at blue light speed. Kevin, morning.
Hi, good morning. Nice to speak to you.
Talk to you again. This FOI, which has shown that the sort of response times for ambulances over the last 3 years has more than doubled. What's your response to that?
It's just ridiculous. I can't see how this rapid response car can even be considered to be withdrawn. It saved my life without a shadow of a doubt, because the paramedic recognised that I was having a stroke, which I was completely unaware of. He managed to get me to Poole Hospital on Blues and Twos in rapid time, and basically allowed me to sit here and have an interview with you today. Otherwise, my life would have been very, very different.
Hopefully this isn't the highlight of that saved life, but I take your point. Do you think it's being run down then, Kev? The fact that it's being used or staffed less and is taking longer to get to calls?
Absolutely. From my own personal experience, again, just with my son in September, we had to call an ambulance. We phoned an ambulance at 11 o'clock in the evening. It was the end of September. 2.5 hours later, a crew from Bristol arrived. 2.5 hours later. Yeah. And the rapid response car can be local, could have been here within a few minutes, assessed the situation. It just so happened my son had a viral infection. We thought it was meningitis. But he had a viral infection, ended up in Poole Hospital for the night. But the rapid response car would have been here, would have dealt with that situation and moved on and left an ambulance available for someone perhaps that needed it more seriously. But the cuts in the service will absolutely have a devastating effect on the population of Swanage and Purbeck.
We approached both the CCG and South Western Ambulance Service for a statement on this. CCG haven't responded. South Western Ambulance say, we and the wider NHS continue to experience a sustained high level of demand. The ambulance car based at Swanage is no exception to this demand and impact. We know and understand that the local community has a vested interest in the future of this resource. We're listening to the views of local people. The exercise is scheduled to continue in 2022. This is the, relevant bit. The Purbeck car is included within the South Western Ambulance Trust resourcing plan, and a correction to a recent Freedom of Information response will soon be issued to reflect this. So, in spite of the local concern, Kev, the South Western Ambulance at least saying, and CCG in the past when we've spoken to them saying that, they haven't got rid of this thing. Possibly yet. I don't know if that word is me putting that in or the campaign is putting that in. How confident are you that we'll be sitting here 5 years hence and this will still be a thing?
I'm not confident they're going to keep the car, if I'm being honest. I think there's been an awful lot of I would say misinformation, because obviously this freedom of interest, freedom of information has highlighted the drop in the service. None of this information was available up until fairly recently. So I think a lot of it's been, I don't want to sort of put words into people's mouths, covered up really. We've been fighting a very, very honest campaign for sort of just over 3 years now, and trying to keep all this information transparent for people to see. But others in authority haven't been doing the same. And I think it comes down to cost. I think they're just someone in an office looking at a spreadsheet on a computer is looking at the cost effect and going, we don't need this service. Where if it saves 2 or 3 lives throughout the course of a year, that's going to have a huge impact on our community here.
Really good to talk to you. Also, go on, Gav.
Sorry, also in the summertime, because we're a very popular tourist destination here in Swanage, for an ambulance to get around the Isle of Purbeck in in the peak time of the summer, is nigh on impossible for them to get here in any kind of sort of sensible time. So the car, again, is essential that it's local, it deals with the community here.
Okay. Kevin Egan in Swanage, talking about the future of the Swanage ambulance car. Story we continue to cover on this show. We'll have more on it after 8 this morning. Welcome your thoughts on it. You can drop me a line, Steve Harris at bbc.co.uk. If you're going to email, you can WhatsApp us on 08000 321 333. You need to store that number in your phone and then start your messages to me with the word Dorset.
The sound of Dorset is BBC Radio Solent.
The latest BBC News for Hampshire, Dorset and the Isle of Wight at 8. I'm Alan Jennings. For years, Swanage residents have been fighting to save their local ambulance car.
The cuts in the service will absolutely have a devastating effect on the population of Swanage and Purbeck.
That's Kevin Egan from Swanage, who had a stroke a few years ago and says he wouldn't be here today without the local ambulance car. More than 8,000 people have signed a petition to save the quick response vehicle and were promised by health bosses it would be fully maintained during a consultation on its future. But Freedom of Information requests reveal the number of shifts where the vehicle has been available and staffed have dropped by more than half in the past 3 years. Kevin Egan again.
It's just ridiculous. I can't see how this rapid response car can even be considered to be withdrawn. It saved my life without a shadow of a doubt, because the paramedic recognised that I was having a stroke, which I was completely unaware of. He managed to get me to Poole Hospital in rapid time. Otherwise, my life would have been very, very different.
Freedom of Information requests reveal staffing and availability of the Swanage-based ambulance car has halved in the past 3 years. That's despite a promise from the CCG and South West Ambulance Trust that the service will be fully maintained until after public consultation on its future has ended. At the same time, response times for the most serious Category 1 emergencies, where a person has stopped breathing, have more than doubled, going from 7 to 15 minutes. Debbie Moncas from the Save Our Ambulance campaign says that is very concerning.
It's really important to keep the Swanage-based paramedic car. We're at the end of the peninsula, and when Poole A&E maternity and children's units go, will be 30 miles, much of it on winding country roads that are packed in the summer from emergency hospital care.